So we are live now on Facebook. I will connect on Instagram. Instagram takes 1 or 2 seconds.
That's all right.
Yes. Okay. We are also live on Instagram. We are live on Facebook. So you are all welcome to our Tuesday Balance and Harmony hour. And today we are coming a bit later in the day. Normally we come up Tuesdays, 3 p.m. Nigerian time. But today, because I need my guests to be here, so I have to adjust my time to a time. So that's why we're coming live now. So balance and harmony hour is a time where I'll talk about stress, productivity, time management, your passion, your purpose, living a fulfilled life. And we know the power and the impact of the stress can have on us. You understand? So today we want to really understand the science behind stress. We want to understand the science behind stress. So if you're watching me, have you ever thought before, what does stress mean? Where does stress come from? How does it function? So if you know it, just write it in the comment section. We'll read about it. So today I have a special person that will be talking to us what everyone needs to know about their health relating to stress. And no other person but my guest, Dr. Ezinne. She's a medical doctor. She's also a certified stress management consultant. And that is the best combination we have to talk about the science of stress. She's the convener of Stress Management Summit Africa. We hold an event every single year. And this year I was privileged to be part of their panelists. It was a great session. I'm hoping to attend again next year. She serves on different boards, and she has this blend of using her medical expertise with the way she communicates and the way she brings out the information that you need to know so that you will get it. And one thing I really love about her, she's real. When I listen to coaches and I see that you are not real, I just want to walk away because you have to be real. You have to show your own vulnerability. You understand? You have to relate, not just theory, and that is what she is. So I welcome you, Dr. Ezinne. The floor is
Yeah.
yours. Thank you so much.
Thank you so much for having me on your platform, Coach Ify. And I must tell you about that stress management summit, that your session. It was really, really awesome because you came authentic and your real life experiences were so powerful to me and also for the audience. So thank you. And
You're welcome.
so for everyone listening, we are going to be talking about the science of stress. One thing you have to know is that this matter about stress, we can't overemphasize on it because of how important it is and how dangerous it can be if it's not properly managed. I'm telling you this as a doctor, as someone that has seen impacts of stress in the hospital, in the clinics, in primary care settings. Okay, so let's start with what stress really is. Is basically how you respond to circumstances. So by definition, they'll tell you it's how you is your response to a huge demand or a perceived threat. What I find this interesting is that part that says perceived threat. That means it could be that there is no threat there, but because of how your brain has interpreted it that this is a huge problem, your body will still respond the same way, like somebody that is being chased by a lion. Okay, so it's more about how you respond, and that is why two people can be experiencing the same thing in a workplace. But one person may be overwhelmed by that workload, but while another person is just taking it easy, like nothing is going on. So it's all about how we respond as individuals. Now, what happens when you're faced with this threat or when you're faced with this huge demand? Since we are talking about the science of it, let's do a little bit of physiology, and I'll try to avoid, although I'm going to use some words, but I'll try to make you understand what they are. I won't really go really deep into details. So when you perceive this threat, there is a part of the brain that processes emotions called the amygdala. So once it picks up this signal, okay, it goes to another part of the brain called the hypothalamus. Let me just leave this words. So it goes to another part of the brain that interprets the signal and then sends signal the to a part called the sympathetic nervous system. Now, what this part of the body does is that it releases a hormone called adrenaline. The importance of this adrenaline is to make your blood pressure to just go up a little bit, your heart rate to go up a little bit, your pupils to be dilated. So what all these are doing is it makes you to be more alert. That means blood will flow to all the parts of your body that needs it at the moment. Okay, so it's like someone that is being chased by a lion. You know that you need to be alert. That's why if a car is coming at the moment now, you would want to run. Okay, you want to run to save yourself. So how does that happen? How does such spurge of energy come about? This is your body's defense mechanism, sending blood and oxygen to the right places to your brain to keep you alert, to jolt you out of that sleep. That's why when you remember, oh, I have an exam and I've not studied, your heart starts beating really fast. And before you know it, that sleep will clear from your eye. And then you sit and start studying by fire by force. So these are all stress responses that we call the eustress. That's the one, this kind of stress that is not dangerous, because the goal is to increase your productivity, is to make you more alert, to save you from danger. And if you recognize these signals, you can actually use it to your own benefit. You know, it will help you to work at optimal productivity. That means when you recognize a danger, your body is asking you, hey, you have to do something about it so that you feel better, so that you save yourself, so that you can return to your baseline. Okay. And your body will also send you signals and do everything necessary to make you get there. All right. Now, on the other hand, when you remain in that persistent state of stress, for instance, you're working in a toxic workplace where you go to work, the place is toxic, and because of what's going on there, you have started having anxiety or worrying so much about the work. And when you're getting home, you've not left the work at home, you still carry what's going on back home. All right, and you're still thinking about it, worrying about what's going on, and you now take it to sleep. Of course you're not going to sleep very well, and you go back to that same toxic workplace the next day. Like, this has become your routine, this has become your day-to-day life. What do you think would happen? Your body will now release a different hormone, which is called the cortisol. I'm sure you must have heard the rave about cortisol, this cortisol face, and all the things that everyone is saying about cortisol. So your body release this kind of hormone that will now persist in the blood. Now, when cortisol is released, the goal is for it to just function for a short period of time, okay? And then it goes back to the resting state. But if you don't get that stress hormone back, if you don't get yourself to rest after you've been exposed to high levels of stress, the cortisol will persist in your bloodstream, which is where all these wahala that comes with stress will now start manifesting. All right. Please give me a minute.
Yeah, it's
Give me
okay.
a minute. Let me make sure my background is quiet.
It's okay. So we are listening to the different things that stress can do for us. You understand? Stress is when you are exposed to a particular situation and the way you respond to that situation. She talked about the advantages of stress. The advantages of stress. So it's not just that you are just stressed. You can use it to your advantage. There's what they call the use stress, the good stress. She now talks about when you are when you can pick up these signals in your body already, when you know those signals when they are coming and you can use it to your own advantage, it helps you out, so how do you pick up these signals in your body to know, okay, now I need to run, now I need to read, now I need to go to work, or things like that? Okay, our guest is back. Are you back?
Okay, yeah, yes, I
Okay.
am. So we are talking about the impact of cortisol on your body. Now, one of the things is that you notice that some people they experience weight gain when they are stressed because
Mm.
they've gotten more hungry. They've gotten increasingly hungry. Because can you give me a minute? Go and have it, okay? Go and have it and close the door. So they've gotten increasingly hungry, And on the other hand, there are people that lose weight when they are stressed. The reason is that they even forget that they are supposed to eat. I think I fall into this category. Just subject me to a little
I
stress.
fall into the other category. I fall into the other category. I When I'm stressed, I want to calm myself, so I'm looking for something to eat.
And the interesting thing is that you're not just looking for something to eat, you're looking for all the chocolates, the ice creams, something that will comfort you. It's more like, hey, I've really worked hard, so I need to satisfy this craving with
Exactly.
like that, like
Exactly.
comfort food.
Sorry to cut you short. Sometimes I ask myself why. Because you are stressed, so you feel tired. And it must not necessarily be physical weakness.
But
You
yeah.
understand? Just like you said, perceived. Then you perceive it as physical weakness. It's, oh, I need to eat to get strength. And you'll be eating and eating, then you'll be
Yes, yes. And
okay.
another thing I noticed is that for myself, when I'm stressed, when I'm so stressed, one of the things I notice is I'm not just getting much more hungrier, but it, I start getting symptoms of lack of certain vitamins. Like vitamin C, where if you're deficient in vitamin C, you have what's called sorry, you have what's called a scurvy, and that is a painful gum. Oh dear. This is part of
You want to take out
it.
some time. Okay.
So
So, okay.
I'm learning, sorry, my audience, I'm learning to be in the moment these days because if I start looking at what's going on around me, it can be overwhelming.
You're doing a great job.
And the interesting thing is that she has been calm all along until
But
now.
but children are known for that. You'll be doing nothing. Once you take your
Like,
phone,
until
everybody will
now.
be awake. It's always like that. It's always she wants us to hear her voice.
Yeah. You want to say something? Okay. So I was talking, yeah, I noticed that my body starts showing signs of lack of certain vitamins. Okay. Like my gums will start hurting. I'll start being so tired, feeling so hungry. There is this kind of feeling of emptiness, like you've not had food for a very long time, So I'll find myself going to the kitchen often and often and often. And if you're noticing something like that, your body is sending a signal that, hey, replenish the essential nutrients. The mistake we make is that we try to replenish with chocolates, ice creams, biscuits, bread. But no, the body is sending signal, replenish me with the essential nutrients that you find in your vegetables and your fruits. And if you do this practical thing, just watch how you feel in the next 24 hours. The difference will be so clear, so massive. Okay, so let's move from that to food.
I have a question.
Mm,
Just for us to understand, what
mhm,
are the effects of adrenaline? Because when it comes, our blood pressure also goes high, our
mm.
heartbeat goes high. Then what is the difference from that to cortisol, so that we'll understand more?
Mm. So, adrenaline is usually involved in acute stress responses. Acute stress responses is the one where there's just a short burst of stress response that makes you want to be alert and do all the things you want to do. Okay. Cortisol, on the other hand, helps to regulate your energy levels by regulating your blood sugar levels, to help you adjust to the situation, so that there'll be continuous sustained release of energy for you to do things. But then when cortisol remains persistently high in the blood, that is when it becomes a problem. So each of these hormones have their own rules in protecting you, okay, in short periods of stress.
Okay.
The problem is when you don't recognize, when you don't listen to what your body is telling you, or you remain in that same environment causing you high levels of stress. That is when there is now a problem. Okay. Did I answer the question? Should I
Yes, you did.
continue?
You did. Thank you.
Okay. So now we are going to talk about other things that can happen. Just give me 1 minute.
It's okay. So you've heard, which category do you fall in when you are stressed? Do you look for food to eat because you are feeling you are lacking energy? You're perceiving as if you don't have physical energy? Or are you the kind of person that you are so stressed that you will forget to eat, hence losing weight? But we have learned today that sometimes your body craves for the essential nutrients that you need to take, not just those food, not the bread, not the rice, but the essential nutrient. That one is new to me, so I have to be careful when I want to eat. When that stress come and is feeling as if I don't have energy, I should take the essential things that will help me out. Yeah.
Yes, exactly. Exactly. So other things that can happen is some people they experience dizziness. I think
Okay.
that one has happened to me too. You just feel dizzy, like you're going to pass out. And then you talk about the headaches, you know,
Hmm.
headaches, that of headaches. I had that for a very long time in medical school, and I didn't even realize that it was stress that was dealing with me. So when it comes to headaches, there are actually different types of headaches. Okay. If you've had this persistent headache that is lasting beyond 3 days, that is when you really need to speak to your doctor. Especially you've been taking paracetamol and now you're now needing something higher than paracetamol to help with the headache. Please speak to your doctor because it's not every headache that we are going to put down to stress. There are more headaches that can even be dangerous. Okay, so just look out for these things. All right, and then talk about tension, like when you're tensed, like you've been so stressed. If you're listening to me right now, you may realize that your shoulder has been like this. So just kind of drop your shoulder. It happens to us when we are so busy. When we are so busy, we forget that our muscles are so tensed.
Yeah.
Your jaw is a bit. Your shoulders are stiff. You've not moved your joints. And by the time you're getting home, everywhere is just hurting. You're like, what's going on? So that muscle tension, muscle pain, joint pains can all be implicated in stress. We talk about the sex drive, the reduced sex drive. There are people that come to the hospital due to problems with ejaculation, okay, problems with erectile dysfunction. Good. So one thing we usually say is in the morning, do you still have do you have sustained erection in the morning when you wake up, like the normal experience that men have? If you have it, that means what's going on with you could be psychological, could be stress related. But if you don't have that in the morning, that means it could be something more that needs to be explored further by your doctor. Okay, so this is just something simple that can differentiate when your erectile dysfunction could be stress related, psychologically related, or it could be due to something organic going on in your
That's a
body.
very great tip. Yeah, that's very great to know.
Yeah. Okay. Then stress comes to your tummy, to your abdomen. That one is something that is much more common than usual. There are different health conditions like this irritable bowel disease that has been linked to stress. Okay, it's a condition where people get this tummy bloating, tummy pain, like they've been going to the hospital, there's nothing that can be pinpointed. And then they realize that when they are stressed, the pain gets worse, the bloating gets worse. That's to tell you that in such people, when you're treating them, make sure that stress management is one of the main treatment, mainstay treatments in people like that. So stress can cause unspecified tummy pain. Sorry. Okay. Sorry, my baby is actually a good baby. I don't know what happened today.
She's still a good baby. She needs your mom. They always need us 24 hours.
Yeah, she's actually a good baby. She's
She
usually
stays
patient.
quiet.
Yeah, that's fine. I think this is one of those days. Okay, I was talking about the impact of stress on our stomach, on our tummy, on our abdomen. Let me use stomach, which is the most appropriate word. Okay, so some people get this pain that is so unspecific. You can't really pinpoint this is where the pain is. So if you're getting these kind of random things that you're just not sure of what it is, just think about what your lifestyle is like. What's going on in your life? Is there a stressor somewhere that is making things worse for you? That abdominal bloating that is making you feel pregnant, think about stress being implicated here. And one important thing, I'm sure that you must have talked about this even in your teachings in your community, is sleep. People will tell you different things about sleep. I sleep when I'm done. Sleep is for the weak. Sleep is for the weak. You sleep when you are in the grave or what. So many things have been said about sleep. But in all my experience, since I've been talking about stress management, this is since 2018, this is 7 years now. Sleep is one singular important factor that can help one's life or damage one's life. That's in called sleep. The interesting thing is, if you don't sleep well, it will worsen your stress. On the other hand, if you are stressed, it will have an impact on your sleep.
Hmm.
Now, poor sleep has been linked to different health conditions, increased risk of heart diseases, including heart attack. There's something called Alzheimer's. Okay, just dementia, memory loss that happens as one ages. Poor sleep has been linked to it, in addition to other brain issues. All right. Now, if science have said, hey, you need to get 7 to 8 hours sleep as an adult, what I will add is it's not just the number that is the important thing here. It is the quality, how you feel when you wake up. That is very, very important here. Whether you are a new mom or you do night shifts, whatever it is that is affecting your sleep at night, make sure that at the end of each day, whether it's in the afternoon or whenever you're getting that sleep, that you're getting adequate sleep that will refresh your mind
Hmm.
when you wake up. How do you know that you felt refreshed at the end of the day? You wake up, you're not feeling sleepy, you're not feeling sleepy during the day. That's when you should be alert. You're not waking up with headaches. You're
Hmm.
not waking up feeling irritable or angry like you fought somebody in your dream. You know, I tell myself that I use the word hate actually. I hate when I don't sleep well because I know myself. Little things will make you angry.
Hmm.
Little things will make you so upset, so irritable. And nobody wants you around them if this
Mm-mm.
is whom you are. Now imagine if this is whom you are every day or most days or most times in a week. People will definitely run away from you because they've given you that tag that it's not that moody person, it's not that angry bird. Whereas all
Mhm.
these things are stemming from poor sleep. Okay. So, one singular factor that can help you manage your stress, regardless of any strategy you hear from us today, is please sleep well. Go to bed when you're supposed to and wake up feeling refreshed. It will go a long way in your day. And then we talk about the impact of stress on our mental well being. Okay,
Mm.
before I talk about the mental well being, let me give this scenario. In the clinic, there was this guy that kept coming back with this cold sore, okay, at the corner of his mouth. So anytime he's treated, he comes back with it again. Anytime he's treated, he comes back with it again. Then we had to ask him a question. We had to ask him, okay, tell me about you. Like, what's going on in your life, about your work? Has there been any increased stress? That was when he started downloading what's going on in his workplace, how his boss has made life miserable for him. And at the end of the day, you realize how stress reduces your immunity. So immunity here means your body's ability to fight off infections. Okay, your body has been built with natural mechanisms to help you ward off infections. That is why so many people may be having flu during the flu season and you're not able to get it because your immunity is kind of stronger, or maybe you've gotten a vaccine that just boosted your immunity to prevent you from catching that. But when you are under that repeated levels of stress, it has a way of lowering your immunity and making you vulnerable to catching anything that is flying around there. Okay, that's why some people they are always in the hospital, always treating one thing or the other, always suffering from recurrent running nose,
I,
sneezing.
I have a question. That's one of my questions here. How
Mm,
does, because sometimes I tell people and they always ask me that question. And sometimes I just, I wave it aside. I don't really answer it into details. How
mm.
does stress reduce your immunity? How does stress make you more vulnerable
Mm.
scientifically? Can you break it down so we can understand
So,
it and really understand?
so the only detail I can explain is still the role of cortisol.
Okay.
Is still in the role of cortisol. Um, let me not give something inaccurate. But if you ask me, I'll be thinking that in increased levels of cortisol, it triggers some kind of inflammatory damage
Okay.
along the blood vessels.
Okay.
Okay. And when it triggers this kind of inflammatory damage, every cell that needs to fight, we have to gather to fight.
Okay. Okay.
Okay. And as they are fighting and engulfing whatever it is that they think is going on, they too will also be engulfed. All right. So
Okay.
this is what I think. This is a theory that I'm able to postulate. But as for the nitty gritty, no,
Okay.
that's
Okay.
something that will have to be further researched. But at the end of the day, just know that it is still due to the increased cortisol levels in the
Okay.
bloodstream causing all of these.
Thank you.
Okay. So, I was going to talk about the impact on our mental well-being. I had this lady that came to the hospital. She's a Nigerian. And when she was on the phone, she talked about how she was having a dizziness. In fact, in her words, she was like, I'm not even understanding what's going on with me. I just can't explain it. I'm not sleeping well. My heart is beating. My heart is beating terribly. That's palpitations. Sometimes I get panic attacks. And then when I explored further, I realized that this is a lady that has been under repeated levels of stress, not because of one thing, but due to several factors. Several factors from her workplace, her family, responsibilities, she's on a visa, changing immigration policies. So all of these were going on at the same time. She didn't address any of them. And before she knew what was happening, she started getting these panic attacks, feeling dizzy, palpitations, that's being aware that your heart is beating really fast. Okay. And for somebody like that, yes, you're going to do all the things you're supposed to do, like checking her blood pressure, doing some blood tests here and there. But if you're going to get her to feel better, one of the things is helping her cope with her stress, helping addressing the root cause of everything that is going on with her. And you realize that for some people, due to lack of knowledge or due to not being aware of how stress can impact them, they go on to develop full-blown anxiety or symptoms of depression. All right. It's just like somebody I spoke to yesterday, one of my colleagues. He was describing mixed depression and anxiety. Yes, people can have that as well. So he was describing mixed depression and anxiety. And I tried to find out what's the root cause? What's the root cause? You find out that at the end of the day, he's having this kind of mindset that he can never be good. He it has gotten to the point that even when he tries to do something when I mean he can never be good, I mean clinically, even when he has gotten to the point where he's doing well, he will still downplay it and say this is like the bottom level, bottom barrel level, like nothing good can come out of him. And then when you try to find out why, he traces it back to his history, how he was out of clinical medicine for a while, and all of that, and all of that. So you realize that this poorly managed stress is not just the physical thing we know. A lot of mental activity goes on to influence the outcome of our stresses.
Yeah.
Okay. So if you're going into the world or you're going into each day with a defeated mentality, of course, you can't expect yourself to win the challenge for the day.
You're already low. You're already down. You put yourself already down. You get treaded upon.
You get what I mean? So for somebody like this, first thing I told him is you need to take a break from that workplace for a full body reset because of the same all the symptoms he was having here. It was now full blown. For a full body reset, when you've done that, then you can now start thinking about speaking to your GP. Because no, sorry, you can now start speaking to your GP to figure out what next for you. Because if you don't get help, you'll still go back to the same circle.
That's it.
Okay. So this is how stress can affect our mental well-being. Some people even go into full-blown psychosis. Psychosis means when it's no longer just anxiety, depression, it has progressed to self-neglect, losing insight into what's even going on with you. You know what our people call mad.
Yeah. Yeah.
Yeah. So when all these things are poorly managed, the manifestations are just out there.
And most of the time, I get this. I have a moms group, and sometimes the moms will say, "These children make me feel as though I'm a mad woman," because you find yourself always shouting, 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 shouting. You
Mm,
understand? Then all of a sudden, you feel, "My God, that is not normal. That I'm always shouting." And then there's, you people are making me mad. You people are making me turn like a mad person.
mm,
And although that is not psychosis on so, but if you want to compare it, it's like that person is already feeling that way
mm,
already, because they are behaving in ways that is not what they want to do, as if it's outside their control. They cannot just come home. Things are not the way they're supposed to be. And
mm,
all what they do is shout and allow the emotions to just flow anyhow, uncontrolled. You
mm,
understand? And because something in them is telling them this is not how it's supposed to be. So they are still fighting themselves, but still showing that behavior that they don't want to.
mm,
So it's a very difficult. And what I don't like, well, what I tell them, say you don't say they are making you.
Yes.
Even at work, and anywhere I go to, I
Mm,
tell myself, take responsibility for yourself. You
mm,
understand?
mm,
We always say, don't react, respond. So don't say, this person made me do this. No, then I will not allow you to make me do that. I have to find ways for you not to get to me.
mhm,
And
mhm,
that's what I wish that people would just learn, that you have, to a large extent, maybe not 100%, but to a large extent, you have the power, you have some control
mhm,
to to decide, to choose how you respond. And if it's difficult for you to respond in the way you want, if
mhm,
it's possible, leave that environment. Leave
mhm,
that environment and go to somewhere else whereby your yourself will show. Somebody said to me, this is myself. No, the way I showed myself was not my authentic self. I said that was you when touched in a particular place. We
mhm,
don't know ourselves 100% until things happen. And when that thing happen, the other you will come out, but it is still you. But it's
mhm,
a you that you don't like. It's a you that you wonder, who is this mad person?
mhm.
So you have to now cut that cycle from where it's coming from, put that break, respond instead of reacting.
Yes. Yes. And I like how you use the word control. When you feel you're not in control of the situation, it now feels like the whole world is against you or is on your shoulder. And that's when you now start reacting, struggling to get to have that control. And most times it's not the best. It's not the best. So at the end of the day, with all these things about stress management, the goal is to get that cortisol levels back to its resting state at the end of the day, because it's firing. It's firing persistently. That's why even if you just go and rest small and go back to that same toxic workplace, the hormones have not returned back to their resting state and you're still having all the symptoms you're getting. That's why they will tell you, take your breaks, so take your breaks, so but we don't want to take it. We want to make all the money in the world.
That's it.
So everything, all the stress management strategies are geared towards helping you bring those hormones back to the resting state. And we've talked about sleep. Yes, sleep is one way that can help you get that. And then we talk about relaxation methods. Okay, some relaxation methods, deep breathing. This deep breathing is something that it's heavily emphasized on. Okay, it's heavily emphasized on because of how effective it is. So when as we are talking now, we don't even remember that we are breathing, right?
Mm-hmm.
So that deep breathing is an intentional effort to help your nervous system regulate itself. Remember when we talked about the sympathetic nervous system, the adrenaline firing, making you all alert, everywhere is bus, 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 bus. So that deep breathing is more like, I'm in control now. And then it helps through there's a nerve called the vagus nerve via the parasympathetic pathway. It's now help everything to slow down so that you can have clarity to even address the situation that is chasing you. One thing we didn't mention about cortisol has a way of going to the brain and affecting memory, okay? Making you forgetting things, making you so forgetful, making affecting your concentration. It just gives you this foggy memory. Me are losing concentration. You're here now, you're listening to this webinar, and next thing you've become so absent-minded. Okay, so it's something that you need to start training yourself to be in control of of both your emotional regulation, your entire self, both how you regulate yourself internally and also externally. Okay, so just like what you were talking about, the story, what's happening in your community, some of us have not achieved or mastered that internal regulation, and it starts with self-awareness. When that child is doing that one that will make you go crazy, you've noticed it and you've noticed this is how I'm going to respond. And when I respond like this, I don't feel good about myself. When I respond like this, it makes me feel like I'm going insane. And I don't like that. So, what do I do differently? Now, self awareness is going to tell you, okay, try something different that will make you feel better so that you respond from a place of calm
Yeah.
and peace and not from a place of aggression. Okay, so you try to, okay, they are talking all the things they are talking, but you're telling yourself, no, I will not. You're taking your deep breaths, you're walking away when it's so overwhelming, like you described. And then when you have that clarity, you can now calmly address it. Even yourself, you'll be proud of yourself that you'll be feeling like you'll be feeling so mature.
That's true. That's true. That's it.
You'll be feeling so mature. You
I
get.
think a lot has to do with being really being self-aware and being intentional
Yes.
about the things we do.
Yes.
It goes a long way to make a difference.
Yes. And the interesting thing about this is that when you practice it often and often and often, it becomes a lifestyle. So
Hmm.
there's something I came across called neuroplasticity. Is the ability is the way your brain adapts by forming new neural pathways. You get, adapting to improve function and structure. So if you practice that intentionality, sorry, if you practice that staying calm in the midst of chaos, your brain will rewire in a way that it will retain it as your normal response.
Normal default response already.
Ehen. So that if situation like that again happens, it becomes your default.
Yeah.
So
Yeah.
that's the ability of our brain. It's so adaptable. Okay. So it's something that you keep training it. You fail, you train it again, you fail. That is why I love groups like your community. It's a place that reminds you, that keeps you accountable, that it is possible. Keep going, keep going. Because if you try to do them yourself, there are times when you just give up. Say, ah, I no fit, I beg.
That's it. There's a book I read. I think that's the best book I've read on stress management, and it's also
Mm,
written by a doctor. She's
mm,
called Dr. Aditi.
okay.
The five resets. So in that book, she talked about, habits, when she has clients or patients that come, and she now gives them at least or the maximum two habits to change. For
Mm-hmm,
example, if you are having this response problem, so the new habit you're trying to change because of to be able to make your brain to master it is anytime you want to talk, take a breath, take a break,
mm-hmm,
then respond. It
mm,
doesn't matter what. So you are every day you're not teaching yourself that. You're not teaching yourself that. Then, like you said, your brain just picks it up and it becomes normal to you.
yes.
So whatever you are struggling with, you don't just stop. You don't say, I'm going to stop shouting. Then what do you do if you stop shouting? You need to now do something in the place of stop shouting. And this
Mm-hmm,
is you creating new habits, one at a time, until your
mm-hmm.
brain masters it, and then it becomes a part of life for you. You know.
Yes, exactly, exactly, exactly. So it's all about knowing that it is possible. No
Hmm.
matter how far you've gone, it is really possible to reset.
Yeah.
It is.
Thank you so much. I have two questions for you.
Okay.
The first one is are there any advantages? You said some at the beginning of stress. Because now I call myself a stress to success management strategist. I believe in the benefits of stress, and you talked about it at the beginning. You said if you understand those signals,
Mm.
then you can react. You can use them. So, what are some of the advantages of stress at all, if there are any?
Um, I won't really want to highlight them like itemizing them one, two, three. The only thing I can say is let every individual master their bodies
Okay.
to be able to recognize and interpret signals. Okay, to be able to recognize and interpret signals. I like using this scenario of you have an exam as an example. You have an exam coming up next week, and then you're going to bed by 9 o'clock. And then you get to bed, all of a sudden, the exam just flashed your mind. Your heart starts racing. Your heart starts. She's now in her happy mood. And then your heart starts racing. You find out that sleep has cleared your eye. So your body is telling you, there's something that you need to address. Now, if you're going to use stress to increase, can I say something, please? Thank you. So, if you're going to use the stress now to increase your productivity, the wise thing for you at that point is to get up and maximize that state, that current state you're in. If not, you're not going to sleep well because your heart is beating really fast. You're not calm. You just be in bed and just be overthinking. If it's in Igbo, I say, "Ihe na-ebe ka na-ebekwa." That's what's
Exactly.
going
What's
on.
going
It's
on? They
still
still go on.
there. You get. So you get up, go to your chair, bring out a book, read a page or two pages, because at that point your brain is so alert. Blood and oxygen has flown, has been sent. It's English. Have moved, yeah. Have flown to that place, and your eyes, your pupils have dilated, like it's so alert, and your senses are so alert that when you're studying, you'll be able to assimilate. So when you do that, it means you've answered something that your body is asking you to answer. You've responded to it. Okay. So in that situation, stress was very useful.
Was stress useful, or you made stress to be useful?
Ah, English. English is well. It wasn't one of my favorites in school. So
Because some people, I also mentor young people, and some people will see that and say, "Oh my God, what kind of a life is this?" And they will still be struggling. Let me just sleep now. They're struggling with it. They're not taking it as signal to say,
yeah.
if I get up and do this, then I feel free.
Mm-hmm.
I have sometimes what I do with them is that when they're like that, they have 1 month to their exam, they're already tensed up. I say, then it's good. Okay, let's sit down, let's make a plan. What you read and what day, everything. We just make that plan. Only that plan that we made, their tension has reduced because they've seen a way. So they've used that, okay, they have this tension, stress coming in. Now we
Mm.
have made a plan. We have said, okay, on so and so days, on these times, we're going to read this already. They've used that stress to their advantage, while others will now carry that stress and be complaining every day and every day and every day. You
Mm-hmm.
know, so it's also that one can use this stress to your advantage, and there are good stress on their own. A woman that is pregnant is stressful, but it's a good stress because it's going to give you a baby, and it's short lived. It's for a particular time.
Mm.
Even my daughter is having an exam now. I told her, I said, the next 1 month, you are permitted to sleep less. You are permitted because it's a particular period of time. If you want to sleep only 2 hours a day for the next 1 month, you are
Yeah.
permitted because you see, the end time. It's not forever. So she started laughing. So that's it. You know that okay, my body will go to stress, but it's because of this. It's for this time. So even
Yeah.
your body takes it in differently
Mm-hmm.
than you are just sleep. You're not sleeping. You don't even know when you will sleep. So that's where I see the difference in using that stress to your advantage and having situations that are stressful that takes you to your next level.
Mm-hmm.
I don't know if you experience it. Sometimes what I do is one of my journals, I write my stress levels down from 1 to 10. And I realized that some days that I can have a stress level of 7, 8. But that day I was so productive. I had a lot, maybe like today now, I went to work in the morning. From
Mhm.
work, I came back, I had an interview. Then I took an having this session with you. Then
Mm.
after this session, I'll do one or two things. Then it was much, it was stressful. I was all over the place. It was a very productive day. So my stress level can be 7, but it's because I worked today. I did that and that and that, and it was fulfilling. It was not just me carrying one load and working. It's me doing different things that took me
Mhm.
forward. So, and other days I'll have a stress level of 2, but maybe boredom was almost killing me because I hate boredom, and it was not to my advantage. So those are the things you have to learn about yourself, like you said, and
Yes.
now use it to your advantage.
Yeah, exactly. It boils down to an individual.
So my last question for you, what helps you with stress personally? What helps you with stress? Let's hear you.
So, I've been talking about stress for a long time to the point that it has become a lifestyle for me. So, if you noticed during this session, my baby was that was when my baby decided that it was
Show
her
it.
own. You know? So if I didn't really know about stress, the usual thing would be to start worrying or panicking. Hey, I need to show up for this session. Oh, I need to be articulated and she's distracting me. Oh, what do I do? And before you know it, I'm forgetting what I'm here to do. But what helps me personally is knowing that what's the worst that can happen?
Hmm. Hmm.
You get. And the second thing is being true to yourself. Being true to yourself. One thing that makes people sometimes be on edge is when they place certain expectations on themselves,
Yeah.
and those expectations were not formed by them, it was formed by the society.
Come for them. Hmm.
Yeah.
Hmm.
If you liberate yourself from that, it will help you to be more true to yourself. There are lots of unspoken rules on how we should do things, how our kids should behave, how we should speak. I'm not ashamed to admit that sometimes English fail me.
Oh, me.
Do you understand? so so if you can liberate yourself from the unspoken rules that
Hmm.
that you have no business with, it will help you to be true to yourself and also lead a much calmer life. All right. And another thing that helps me is knowing what my goal is.
Hmm.
Like if
Concept.
I'm faced with something that is challenging, I'm already thinking of the outcome, not the challenge itself. Okay. Let me give an instance. Um, okay. My husband recently wrote me a message about something I did. So if it's before now, I'll try to put up a defense, you know. But because of the lifestyle, I didn't even see it as an issue to start with.
Hmm.
All right. Rather, I saw it as an opportunity to connect more with him, to uplift him, like his mood, just, because I'm already operating from that place of calm and peace. If I was operating from a place of anger, a place of poor sleep, of course I'm going to interpret the message differently. That's why
Exactly.
that's why I tell people,
Exactly.
don't start your day feeling defeated already.
Exactly. Ah,
Because
That's
you now win the battles of life for that day.
that's the truth.
So
Ah,
be in control as much as you can, no matter what's going, no matter how much the children are screaming and no, not now. Thank you. Please, mom. No. No matter how much the children are screaming, just as much as you can, try to be in control. At least that's your internal regulation. And then I can't mention anything about stress management without mentioning our faith. We are big on our
hmm.
faith, whether we like it or not. So even if the
Hmm.
world is going towards a direction denomination where they don't want to talk about God. They are like, somebody have once told me I should put God aside and have a conversation. I'm like, why am I putting God aside? Is he not the center for me? So we are big on our faith. Let's not shy away from it and rather embrace it, because if you notice, for many of us, once you are not in alignment with your faith, it's as if you're struggling with each day. It's as if you're struggling to meet up with everything else that is going on. All right. So as much as you can, make sure that that centerpiece is not affected. Kosi, wait a minute, okay? I'll come to you later. Let me finish. Thank you. So make sure that that center piece of your life is not in. Oh God, these children.
You're finished already. Just let mommy say her last words.
I'm
Then
telling
you
you, I do you know something that
can
they
you
always
slide.
do. Just when you're in that session, as in when you're enjoying the session, that's when they'll now remember to ask you for something that they know you say no to. Listen to me. You want this, right? You want this, right? Then wait. Let me finish, okay? I love you. So, no worries. Please don't. Okay. And I don't want the consequences. Okay. They know what they are doing.
Children, they know. Forget it. They
They know
know.
100%. Okay. Bye, baby. So, I was talking about our faith. So, if I notice anything that is troubling me, sometimes it gives me this signal that maybe I've not prayed for that day, and most times that's the truth. So as much as possible, I try to make sure, of course it's not by my might or by my power. So, most times I try to play my own part by being in alignment with my faith in God, because I believe that if I commit my cares to him, he loves me so much. He's a present father. He loves me so much, so he will definitely take care of it. Like, he loves me to the point that he can't leave me to be stranded. That even if I fail that interview, I'll still get a job at the end of the day. He just needs me to work hard. So I try to work from that stance of it's possible. That
Mm.
stance of there's someone that is taking care of things for me. That's why, let me say, for instance, there was somebody that is very close to me. One day they called me and told me that he was taken by the police. And one of my friends told me, call this person now, let's know what to do. I'm like, relax. You don't do how do they call it? What they call it? You don't go into a knee-jerk reaction. You may make mistakes. Knee-jerk, when you tap at the knee, your leg will just move quickly. I'm coming. Your leg will just move quickly. Okay. So because of that, you don't. Kosi, can you wait a minute? So because of that, you don't exhibit that kind of knee-jerk reaction, because you may make mistakes by calling the wrong person, or you may make mistakes by saying the wrong things that will even implicate the matter. So at that moment, just stay calm and try to get the entire fact of what's going on. All right, so that you can make much more logical assessment and reach a much more logical conclusion that will be more restful for everybody involved.
I totally agree with you. That's what the Bible says, that when we pray to God, we make our supplication, so that the peace of God that passeth all understanding. That peace
Exactly.
gives you calm. My own what the book of the Bible that I use for my coaching is the book of Philippians.
Mm,
Is just read it. I read it almost every last year. It was my main book, and I call it my stress management book.
mm,
Different things, supply for your need, emotional need, financial need, just relying on God. And
mm,
that's my best. I keep saying my default is natural default is peace. Because in peace you have understanding, you have clarity,
mhm,
you know what to act. But if you're already agitated, like you said, you just make mistakes.
mm.
Just make mistakes. Thank you for those three. of 4 powerful things that you do. And I just pray that our viewers will just pick on it. There are things that we're not just we did not just study them and come here. These are things that we experience. You
Mm-hmm.
know, we're not perfect, but if you start using them on a daily basis, you see that your life is different. You talk about your goals, and I believe part of your goals are those the things you are passionate about. And when
Mm-hmm.
you're working where you're passionate, you have less stress, or you cope better with stress because you are in you are in your zone, you
Mm-hmm.
know. So I thank you so much for your time. I thank you for your calmness. I thank you for your kids. I
They
thank
want
you
to
for
show themselves.
they must now. For me, I love kids. But I don't as much as I one wants to discipline kids, but when
Mhm.
kids are young, they show that they are kids. You understand? We have to know when if it's a teenager is a different case, they will not even try. So young kids like that, they are kids.
Yeah.
So thank you so very, very much for coming. Thank you for giving us an insight into the science of stress. I believe that you have had some understanding of this thing. God bless you and your family. I hope when I call you again, you will come and give us more insights.
Thank you so much. I really had fun with this session. And even what you shared was also insightful, especially as a parent. I have 3 kids here, and that insight that I'm not alone. There are times when you feel just insane.
But that is it. That
But
is
it's
it.
all good.
Yeah, it's all good. Enjoy it.
Right? I
Enjoy it, yeah. Enjoy. Do you know, let me put it this way. I
can't
respect moms that when my kids were growing up, I
wait.
did not walk like that. You understand? So when I see moms walking, I respect them because I know what it is, you
Mhm.
know, and especially for today's world. So more grace, more you're on the best path. You have stress management, you have your faith in God, you have your medical experience. What can go wrong? God bless you. God
Thank you.
bless you.
Thank you
Thank
so
you,
much.
everybody, for joining us. If you have questions, write in the comment section. I'll also put the link of Dr. Ezinne in the comment section. She offers different programs. You can follow her and follow her programs. Information is power. Information is power. And when you act on those information you have, the sky is your limit. You can move mountains. You can do great things. So God bless you all. Have a nice evening.
Bye.
Bye.